Hi, I'm Dr. Stefan Muehlbauer. I'm an ER doctor and the ED chairman at St. Francis Hospital. We're an emergency department in Long Island, just outside of New York City. Before I went into emergency medicine, I was a basic science researcher studying microbiology. I was studying viruses as well as biodefense. Honestly, I never particularly thought that that background would come in quite as handy as it has, and I certainly never thought that I'd be seeing something quite like what we're experiencing right now, fighting an invisible enemy like we've never done before. One area that gives me hope is that we're now starting to get better every single day, experimenting and seeing what works with people who are doing active research, including a couple of trials here, and I think we're actually getting better at taking care of patients with COVID-19, and we're starting to see that all of these efforts are starting to have better outcomes. One aspect of this, which is really, really hard, and not something that I'd particularly expected, is we're starting to see patients who really waited too long before coming to the emergency department. We're seeing people with emergencies like strokes and heart attacks and severe infections who we really could have helped a lot better had they come to the emergency room right away. And I think the fear of this virus is keeping people who would normally come and get help for their emergencies right away. It's preventing them from getting that help as soon as possible. And it's very, very hard to see patients who we could have helped more who just waited too long. So I want to get the message out that if you think you're having an emergency, come right away to the emergency room. We're here, we're open, and we can help you and we can get you better. I miss being able to be physically close to my patients the way I used to be before COVID-19. I used to be able to hold hands with my patients to comfort them. I used to be able to stay close to them at the bedside, to their families. And the need to keep everybody safe and to keep distancing, that's been very, very hard. One hard thing just coming home is I miss being able to see my mom, to hug my grandmother, and I miss being able to come home and hug and be close to my kids. Recently, when I come home, I actually change behind the house and I disinfect right behind my house before even coming in. And then I go home to my basement and try to hide away from my family, my wife and kids, just to prevent from spreading anything that we encounter at work on the front lines. I'm incredibly excited and looking forward to the day when maybe we can go back to the way things used to be.